We are covering the critical details of Medicare enrollment periods and the costly late enrollment penalties you will be tested on for your health insurance exam. The first and most important is the Initial Enrollment Period, your IEP. This is the 7-month window surrounding a person's 65th birthday. It begins 3 months before their birthday month, includes their birthday month, and extends for 3 months after. An exam question might describe a client turning 65 in August. Their IEP would run from May 1st through November 30th. The common trick is to ask what happens if they enroll in the months after their birthday month. The answer is that their coverage start date will be delayed. If they miss the IEP entirely, their next opportunity to enroll is the General Enrollment Period, or GEP. The exam requires you to know these dates precisely, January 1st through March 31st of each year. A key testable point is that coverage elected during the GEP does not begin until July 1st of that year. They will give you a scenario where someone misses their IEP and wants to sign up in February. You must know that their coverage won't start for 5 months. A major area for exam questions is the Special Enrollment Period, or SEP. This allows someone who is past 65 but actively working and covered by an employer's group health plan to delay enrolling in Part B without penalty. The SEP is an 8-month window that begins the month after employment ends or the group health coverage ends, whichever happens first. The exam will try to confuse you with COBRA. Remember, taking COBRA does not extend the SEP. The clock starts when active employment ends. Now for the penalties, which are a guaranteed source of exam questions. The Part B late enrollment penalty is a lifetime penalty. It is calculated as 10% of the standard Part B premium for each full 12-month period the person was eligible for Part B but did not enroll. An exam question might state a client delayed enrollment for 40 months. You must recognize this is 3 full 12-month periods, not 4. The penalty would therefore be 30%. Added to their premium every month for life. The Part D penalty for prescription drug coverage is calculated differently and is also a lifetime penalty. It's 1% of the national base beneficiary premium for every full month the individual went without creditable drug coverage after their IEP. A test question could involve a 15-month gap in coverage. This would result in a 15% penalty, calculated on the current year's base premium and added to their monthly Part D premium. To keep the penalties straight, use this phrase: B is for big year, D is for detailed month. Part B has a big 10% penalty calculated by the year. Part D has a more detailed 1% penalty calculated by the month. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.